tell us, why do you think Delta is driving such big outbreaks across the world?
Well, as you've been hearing, Delta is the most infectious variant to emerge so far. It's at least twice as infectious as the original strain that came out of Wuhan in China at the end of 2019. We know that people who are infected have really high levels of virus in their upper airways, something like 1,200 times more viral load than patients who are infected with other strains. And that is creating a lot of transmission, and it's as infectious as chickenpox.
Tell me, Jason, I mean, in layman's terms, we're not going to get too technical here, but, you know, what is it about this particular variant that makes it so easy to pass on?
Well, just the fact that when you are infected with this particular virus, you are shedding a lot more virus. And we know that those viral particles have greater affinity. They're better at locking into the ACE2 receptors on our cells. The way the virus gets in is just much more efficient. So it could be also that you need a lower infectious dose to get infected with the SARS-CoV-2 virus and to get COVID.
And to the bigger question, I guess, Jason, are vaccines working on Delta? How important is it that we also look at hospitalizations and deaths, apart from obviously rising virus cases?
Yeah, so we know that the vaccines are doing a very good job at preventing hospitalizations and deaths across the board. When we look at specifically at COVID and how effective the vaccines are at preventing any kind of COVID, so any symptom of the SARS-CoV-2 viral infection, we see that there is a difference across the vaccines. Most of the data are coming out of Israel, the US, and the United Kingdom, and we see that after the first shot, there is some benefit, but it doesn't come until the second vaccine dose that we see the maximum benefit. And that is significantly lower in AstraZeneca than it is for the mRNA vaccines, the Moderna and the Pfizer-BioNTech shot.